Hi, everyone, and thanks for joining us for the May 2021 Match Coalition monthly meeting. I'm honored to be able to introduce you to Allison Northrop. Allison has years of experience advocating for the health and well being of all people. She has years of experience as a legislative staffer and is currently the Associate Director of Government Affairs for the Association of Maternal Child Health Programs. It's my honor to be able to introduce you to her today and learn more about the amazing work that she and her organization are doing.
Allison, it's so awesome to have you with us here today. We're going to jump right in. Of course,
Sure.
we want to learn as much as we can about the Association for Maternal and Child Health Programs, and certainly about yourself as well. So, why don't we just go ahead and get started? Let's begin. Tell us a little bit about your organization, your mission, and what you guys are focused on.
Sure. So, the Association of Maternal and Child Health Programs, we are commonly known as AMCHIP, and we are a national membership organization. So, we represent folks in state health departments who are administering statewide public health programs to improve maternal and child health. And our members are across the United States in every state, territory, and jurisdiction. We serve as a national resource and a partner for our members and for all stakeholders who are working to improve maternal and child health. And we define that as all women, children, youth, and families, and by extension, communities in the US. So it gets our circle of inclusion and work gets pretty broad.
Impressive. It's like, how do you prioritize with that? So, where do you begin?
Yeah, so I mean, our core membership really is in state public health departments, and the core programs that they're administering are maternal and child health programs and programs for children and youth with special healthcare needs, as well as programs targeted at adolescent health. And of course, this coalition is focused on maternal health, so I'll focus in on the work that we do there. But broadly, the goal, the reason that AMCHIP exists is to serve as the voice for our members in Washington for federal policymakers. So advocacy is a core part of what we do, and that's the reason that I do the work that I do. And then it's also to be a technical assistance provider to our members. So developing resources, providing peer learning opportunities around state efforts to improve maternal and child health.
Wow, that's really awesome. Would you say are some of your key stakeholders that you find yourselves working most closely with?
Sure. So a lot of our work is federally focused. So a lot of the stakeholders that we partner with in Washington, D.C. are national organizations. So a lot of the national clinical organizations that focus on maternal and child health, like ACOG, Society for Maternal Fetal Medicine, American Academy of Pediatrics, and then specifically around maternal health and eliminating racial disparities in maternal health outcomes. It's been organizations who are, some of whom are on this call, like the National Birth Equity Collaborative, the Century Foundation, Black Mamas Matter Alliance. March of Dimes is one of our core partners. Um, and then, of course, within um, our state members, they have networks of their own that are very much state focused. So we have kind of a broad reach at both the federal and the state level.
When you look at the area of maternal health, even within itself, there are so many areas of which you could focus. I particularly know that you mentioned health equity and racial disparities. Can you talk a little bit more about that? What are some of the programs or education efforts that your organization is currently engaging in?
Sure. So, oh my gosh, so much. So, a couple of key priorities or key programs where we're focused. AMCHIP is a core partner of the Maternal Health Learning and Innovation Center. So this is a new National Technical Assistance Center. It's housed at UNC Chapel Hill, and AMCHIP leads work on their policy core. And so the mission of this resource center is to improve maternal health with a particular emphasis on improving maternal health outcomes for Black women and birthing people, Indigenous women and birthing people, and women and birthing people in rural areas. So it has a very much a racial equity and a health equity lens. Through our policy, our advocacy work, AMSHIP is a member of the Equitable Maternal Health Coalition. So this is a relatively newly launched coalition. Some of your organizations are also a part of the Equitable Maternal Health Coalition, and that group is really focusing in on a few key areas, including policy, and coming to consensus on what can be the real drivers of improving maternal health equity through those different avenues. And then one other item that I'll mention is so in addition to government affairs work, AMCHIP has a very strong programmatic focus. And so our programmatic team focused on women's and infant health has a number of initiatives right now focused explicitly on infusing anti-racism into the work of state public health towards improving both birth and pregnancy outcomes.
It's really awesome. I would imagine, I mean, you've been in government affairs for what, I guess nearly 10 years or perhaps a little over 10 years. And I mean, okay, don't take any offense, but it takes forever to get stuff done. I mean, I'm sure I'm not the only one on this call who feels that way. And today, like just as you heard from Allie's update, there's so much what seems to be activity that's happening, but sometimes I wonder, how are we going to get to where we're trying to go to? Like, how do we ultimately make for the changes that we're looking to have transpire when it comes to the inequalities, when it comes to the, applications of digital technology for maternal health? What are your concerns? What do you see as the challenges, and how do we go about overcoming those?
Listen, I think this is our year. So there are so many things coming together right now. There has been significant congressional interest in improving maternal health for the last several years, due in large part to community-based attention and the media spotlight on maternal health in the United States. And so we have this whole collection of really strong legislation that has been introduced the previous Congress and is now being reintroduced this Congress. Something that I find really disappointing is that there were no bills passed last Congress to improve maternal health. Mm-hmm. And that just is, it shouldn't be. There was really strong legislation that had passed the House, and it didn't make it across the finish line. And so I think where we are now is in a position to say to Congress, like, you have great legislation, you have all of these champions in the Senate, in the House, in the White House, who want to pass legislation on this topic and increase funding for existing programs. And so I strongly believe that we could see both a bipartisan effort to pass additional legislation this year that could really make a difference, in addition to maybe seeing a significant part of the American Families Plan include a focus on maternal health. There's an item in the American Families Plan summary that the Biden White House put out last month, and no one's really talking about it much, but there's a call out for an investment of $3 billion in improving maternal health as part of the American Families Plan, which is like the social infrastructure proposal from the Biden administration. Congress is writing that legislation now, and so we don't have the details yet of what that $3 billion could be, but we have a real opportunity to try and push some of this legislation that's been introduced this Congress and last Congress and try and get it across the finish line this year.
That's really excellent. Now, much of that, of course, is around some of the more conventional programs that have been out there, right? And what's unique about the MATCH Coalition, which is the Maternal Application of Technology for Community Health, is that emphasis on the word technology. And it seems as though while there is some where progress is being made, it hasn't necessarily hit that particular string yet, right, in terms of technology. What do you think is needed? What more would you suggest that the MATCH Coalition participate in to help us to educate more policymakers around this topic of digital health and its role in helping to prevent maternal mortality and morbidity?
Well, I think that there's a real chance that legislators will be open to that conversation, in particular this year, because we all have a new understanding because of COVID of the challenges in accessing care when there are new barriers or additional barriers to accessing care, the role that telehealth can play in removing some of those barriers if it's done in a way that is intentionally equitable. And so I think that legislators will get that in a way that they may not have a little over a year ago. There are really strong bills that have been introduced or will be reintroduced that incorporate a core focus on tech. And I know you guys are focused on bills like the Connected Mom Act and the Tech to Save Moms Act. With the Connected Mom Act, it already has bipartisan support. That's really great to see. The Tech to Save Moms Act, no reason why it couldn't gain bipartisan support. So I think having those, moving forward, those bills that have already been introduced, there's a strong possibility that could happen. In terms of additional proposals, I think it's just a matter of prioritizing and figuring out, okay, where can we see the most difference in terms of incorporating the value of tech into these maybe existing proposals or additional standalone legislation. But definitely now is the time if you want to have additional authorizing legislation to like get it together so that it can move as part of a package that moves later this year.
Very good. That's really very insightful. Just as a reminder, folks, we are going to let some time for some Q&A. So we're going to open up to Q&A in just a moment. I have just one or two other quick questions for you. But for those who have questions, please, we'll ask you to come off of mute. We want to hear your voices, and you can ask your questions directly to Allison. So Alyson, one other item I'd love to learn about is where your association really sees the biggest opportunity. What are the things that you're looking forward to? I've noticed you said that this year is a really big year. How does that translate into some of the maybe perhaps more audacious goals that your organization may have set for yourselves? Can you tell us about that?
I would love to. So I say that this is a big year because for a few different reasons. One of the biggest reasons is we have some incredible opportunities in the new administration. So we have Vice President Kamala Harris, who led the Black Maternal Health Momnibus in the Senate, now with a new platform to speak, and she is speaking about Black maternal health and elevating voices of Black women and Black women-led organizations to talk about the solutions that are needed at a federal level. And so I think we have like a pocket champion in the White House who can help continue to elevate the issue and really push it as part of the administration's priorities. We also have, as Ali mentioned earlier, there's interest and commitment from leadership in the House and the Senate in this topic in improving maternal health. And so I think, it's on that list of priorities for the folks who are in a position to move legislation this year. And so what that means for AMCHIP, for our organization, is making sure that it doesn't get left off. So making sure that we continue to push and say, you need to have this as part of the infrastructure package that moves. We did not have legislation last Congress. It needs to happen this year. Moms can't wait. So we've already seen some movement. So we saw, a significant win. It's not everything, but having a new option for states to pursue Medicaid extension to 12 months for postpartum women. And so it's not mandatory, it's an option, and it's not forever, it's for 5 years, but it's big. And so continuing to push and build off of some successes and go for as much as we can get in this moment that we have.
I love it. Those are definitely some things to look forward to. Why don't we go ahead and take some questions from some of the other participants today?
Hey, this is David. I guess one question that I have is, how can match be helpful to your efforts as well? What can we as a coalition do to help you with AmChip's advocacy?
Yeah, I mean, this is such a great group of, with a unique focus. So I think that the members of the coalition and the voice of the coalition as a whole could be really valuable in advocacy efforts. You guys are already obviously doing some of that on your own, and hosting a briefing with a senator speaking was a great way to kick off the coalition and make a real splash. I think as we go further into the Congress, there will be opportunities like markups in the committees of jurisdiction where there will be sign-on letters that having Match as a co-signer, activating your members and interested folks to share information about when we have those moments of really wanting to show support for legislation that's moving. Staying up to date on what's happening, and I think AmChip should really become a contributor for this coalition as well, just so we can keep sharing information, because clearly you guys are tracking the same bills that AmChip is, and I think we can do so much if we're sharing information and lifting up each other's priorities. So I really appreciate the question and think that there's a lot that we can do to support each other's priorities.
I think we'd love that.
Yeah, we most certainly would. Absolutely. Great question, David. Anyone else?
Yeah, definitely. It seems like you guys are really bringing together like meaningful partners in this space, as we are trying to do. What do you think have been some of your biggest hurdles with the Hill, or kind of putting this issue to the forefront?
Yeah, so I think that last Congress, we got caught up in, unfortunately, some partisan politics at the very last minute. So there was a big COVID package that, had to get across the finish line, and we thought there would be some maternal health legislation included in that, and it got stripped at the very end because of some high-level pushback, and not to do with the content of the legislation, more so honestly just like some partisan issues. And so our biggest challenge is making sure that we keep this as a topic that should not be partisan. This is something that can and should be a priority for members of Congress across the political spectrum. And it has been. And so we want to make sure that it stays in that sweet spot where it can gain the attention and the focus and the support across the political spectrum, while at the same time, pushing for the aspirational policy goals that we really want and need in this space that maybe aren't quite ready for bipartisan support, but we need it as the leading edge of what we're pushing for. So I think it's a balance between, getting done what we can done with bipartisan support and really pushing members of Congress to go for even more.
Great question, and love the perspective that you have on that. Renee has a question as well. Renee, please go ahead.
Yeah, quick. I'm Renee Kwashi. I work with the Consumer Technology Association, so we're really focused on technology-enabled healthcare. So could you just talk a little bit about the role you see technology playing in addressing some of these issues today, and the role technology is going to play in addressing some of the issues you discussed 3 to 5 years down the road?
Yeah, I think today technology is enabling us to reach communities that have whether it's primarily geographic barriers to accessing care, or things like not wanting to be exposed to COVID in a doctor's office, things like hub and spoke model, or training programs like those through Project Echo, remote monitoring. We have the technology to enable folks to access care where they need it. In many cases, we don't have the the broadband infrastructure that's needed, and that really has come to a fore in the past year. So I think that states and local communities are implementing tech solutions today. And so I think federal investment in replicating those successful models is something that we can do today. I think long term, it's going to take significant federal investment in broadband infrastructure and in making sure that there is equitable access to things like the Wi-Fi that's needed to have a secure connection for telehealth. And I feel like I'm a little hindered by my imagination of what tech could do. So, it's bringing forward the solutions and translating that from the tech world into, the public health world like mine, so that I can also be understanding and communicating the options that are out there for incorporating tech solutions into improving maternal health.
Wow, that's, it's really very insightful of you to recognize the opportunity it has, and that we've only just begun, right? There's just so much incredible work to continue to do, and that digital health really does have a very key role that it can play in helping facilitate some of these goals and objectives that we've set out for our organizations and for the improvement of overall health. So thank you so much for those perspectives. We'd like to welcome everyone to turn back on your video if you'd like. And perhaps, I can't believe our time is already up. One closing question for you, Alyson, that I often enjoy asking folks is in relation to resources and tools, right? It's always great to learn from others some of the resources that they find most invaluable that perhaps others haven't heard of. Is there any resource or tool that you'd like to recommend to the members of our association to start to take a look at?
Sure. So one that comes to mind is a tool that AmChip developed last Congress that was, it's a simple tool. It's a bill tracker, but it's because this world of maternal health policy is filled with acronyms that all sound the same. It can be really easy to get all the bills mixed up. So I'm actually curious if folks think it would be worthwhile for AmChip to publish that tool again this Congress and have it as a publicly available document rather than just our internal reference to all the bills, all the mom bills that are out there. So folks can keep them all straight. I found myself, regularly referencing it before heading into meetings with Hill staff, just so that, especially because there's some overlap in many of the provisions in different bills. So I'm curious to hear actually folks' feedback on whether something like that would be of interest, or if your needs are already being met elsewhere.
I know it'd be useful for me. What do others think?
Hi, I think it would be very useful.
That's great to hear, and definitely something that I would like to start turning from my current Excel spreadsheet into something maybe a little prettier to share more broadly.
Well,
Yeah,
Alyson, go ahead, David.
I was just going to say, I think with the proliferation of whether it's telehealth bills or broadband bills or specific maternal health bills, I think having a tool like that will be very valuable. There is just so much going on that impacts the the maternal health environment. So I think that'd be great.
Absolutely. Well, we can't thank you enough, Alyson, for your time today. This has been amazing. You are a wealth of information, and we'd like to thank you. We thank you so much for your participation and support of the Match Coalition. We hope to see you engage in some of our future programs that are going on and share the message of the work that we're doing with others. And we look forward to helping to support you in your efforts with our area of subject matter expertise, which is in the digital health aspect of us helping to make for a safe pregnancy journey for all women. So thank you so much again. And thank you to everyone for participating. We're going to close out now just by allowing folks an opportunity, as we always like to do, to share any news, any updates, things that might be going on in your organizations, any product announcements, anything that you'd like to, maybe grants that you're aware of that you'd like to share with others. Please do take the floor.
Hi, everyone. I'm Dorshonda Evans, and I'm with the Rural Health Association of Tennessee. And we'll be hosting on June 2nd a maternal health in rural Tennessee webinar, and it's free, open to the public. We're going to identify maternal health deserts in Tennessee, talk about the impact and health outcomes of lacks of access to care, and exploring policies and solutions. So if anyone would like to attend, I'll go ahead and put the information in the chat. Thank you.
Excellent. Thank you, Darshana. Appreciate that update. We're looking forward to that. That's June 2nd, right?
Yes, ma'am.
Very
June
good.
2nd.
Awesome. Anyone else? Any updates they'd like to share? Any research perhaps that you've been conducting, or any big events? CTA, you guys always have stuff going on at the CTA. Anything you want to share from the CTA?
The only thing I'll say is that we had a big interassociational meeting last week. David was part of that too. And one of the things that came out was one possible area of collaboration is doing a series of briefings on health equity. And obviously maternal health will be one of the issues that comes up in that, but that's still in the planning stages.
That's exciting to hear. And I know that you guys have been doing a lot of work on health equity, and we certainly do recognize that addressing the needs of women is a key factor in addressing issues related to health inequalities and health inequities. So glad to hear that, and we'll keep watching your progress. Anyone else before we go? Any other news? All right, well, I hope that it is a beautiful May 18th, wherever you are. Enjoy it. And we look forward to seeing everybody next month, in the month of June. Between now and then, you know what you can do? You can go online and post, and repost as much of our social media as you can. And thanks everybody again for your time today. Enjoy the rest of the day and the rest of the week. Take care.
Bye.